advancement in treating the bleeding disorder?
So depends on the bleeding type of bleeding disorder. If it is something like hemophilia, the product has to be transfused. So whatever missing factor 8 or factor 9 or von Willebrand factor, this has to be given externally, from outside as a transfusion to stop the bleeding. If it is platelet dysfunction, then that has to be transfused from outside. The latest advancements, I would say, is gene therapy, where we know that hemophilia is a genetic disorder. So in patients for whom it is extremely difficult to give them factors at the right time, or despite giving factors, they're still having bleeding problems, there is gene editing or gene therapy that is being still tried out. It is not one of the standard of treatment or standard of care that's being offered even in the Western world, but that may be an option we may be looking at a few years down the lane if we have enough successful patients who have undergone gene therapy.
How the lifestyle of a patient will change after diagnosing bleeding disorder?
The goal is to try to give them a normal lifestyle as much as possible, but if we know that a patient has a bleeding disorder, if they have to undergo a particular surgery, they need to take clearance from a hematologist, and detailed instructions need to be laid out so that they don't undergo the surgery without those precautions. Risky for you to ride a two-wheeler, especially without a helmet. Definitely discourage you from riding a two-wheeler without a helmet. If you have to use a two-wheeler, please always use it for short distances and use a helmet. If you have to go for a dental extraction, helps to take a letter from your hematologist and mention to any doctor you meet that you have a bleeding disorder. Don't ignore that, because it is a part of your life, and any surgery, any medical procedure, it's always good to know, good for the other doctor, the person who's treating you, to know that you have a bleeding disorder. Apart from this, going for adventurous activities, it could be skydiving or bungee jumping, diving. All of these require special care and precautions, and make sure you always get a clearance from your hematologist before you engage in these adventurous activities.
What is the role of caregiver or the family members for the people who has the bleeding disorder?
That's an excellent question. So, especially in pediatric patients, see, when children are born, we would like for them to be as normal as possible. So, this message is specifically for parents. If you notice that your child is having excessive nosebleeds, they are having gum bleeding without an explanation, they are having bruises, large bluish patches on their skin, especially on their joints, they're having joint swelling, the age when they start crawling, when they start walking, falling, hurting themselves. So it always helps to have your radar up, sort of to keep watching your child's symptoms and observing for bruises and patches over their body. And if you observe them consistently or repeatedly, then make sure that you seek your pediatrician's help, who would in turn refer you to a hematologist or a blood specialist, so that if the child has a bleeding disorder, it can be diagnosed at the right time before any untoward incident can happen. Apart from this, as a society member, I would say it's important to know about bleeding disorders, because you could be an onlooker for a patient who has a bleeding disorder. So first thing to do is try to apply pressure to the site where bleeding is happening, and then try to seek the nearest medical help possible. Also, patients with bleeding disorders or abnormal platelet functions or these clotting factor deficiencies could benefit a lot from blood products. So in India, we are still, to some patients, we are able to give what we call recombinant factors, but a lot of patients require what we call fresh frozen plasma or cryoprecipitate, which is extracted from the blood of donors. So try to give regular blood donations, so that these, not just blood or platelets, but these clotting factors, which are usually taken in the form of fresh frozen plasma or cryoprecipitate, can be used to save the life of someone who has a bleeding disorder or who may be going through life-threatening bleeding.
What are the key challenges the bleeding disorder community faces in terms of healthcare access and support?
Very relevant topic in India. As I mentioned, hemophilia A and B patients, especially if they have moderate to severe hemophilia, especially the severe hemophilia patients, they require regular factor replacement, and I mean once every 2 to 3 days. For hemophilia patients, it can be 2 times a week. For hemophilia B patients, it is 2 times a week, and for hemophilia A patients, almost every day or alternate days. So these recombinant factor 8, or these factors that are produced, can be extremely expensive, difficult for them to access because they're not readily stocked at your regular pharmacies. Most hospitals don't have it unless they are a multi-specialty hospital and also have a hematologist who's easily available. That is one. And the second thing is lack of awareness about bleeding disorders. Most people don't even know that there is a diagnosis called bleeding disorders. Most people have not heard about something called hemophilia or von Willebrand disorders. So lack of awareness about bleeding disorders, and including some people in the medical community. So some doctors may not be aware that a patient might have a bleeding disorder, might plan a surgery without the complete evaluation. It really helps a lot to create awareness about these disorders so that patients themselves become the advocates for this, and they can make sure that the best care is provided.
How can listener help for better care and support for the people with bleeding disorder?
Awareness about any condition or disorder is step one to trying to cure, or trying to get the best outcomes for that particular condition. So raising awareness is, I think, point number one, so that more and more people know about it, more and more people talk about it. We discuss it as a community, we discuss it among doctors, we discuss it as friends, relatives, patients, whatever it is. The more we talk about a topic, the more it is out in the open. So spread awareness as much as possible. March is the month of awareness of bleeding disorders, so try to gather as much information about bleeding disorders, especially if you have a family member or a friend who has a bleeding disorder. Try to spread this video across to as many people as you can, so that they at least know what to watch out for and whom to reach out for in case there is a suspicion for a bleeding disorder.